You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, today, for the first time in 2 months, Dr. Fauci reappears, as well as Dr. Birx talking about coronavirus. Why? Because we're seeing a spike in the country. This is Dr. Fauci today speaking before the cameras.
Such an unusual situation because of all of the decades that I've been involved in chasing infectious diseases. I've never seen anything that is so protean in its ability to make people sick or not. There's no other infectious disease that goes from 40% of the people having no symptoms to some having mild symptoms, to some having severe, some requiring staying at home for weeks, some going to the hospital, some getting intensive care, some getting intubated, some getting ventilated, and some dying. So that depending on where you are in that spectrum, you have a different attitude to this particular thing. But anyone who gets infected or is at risk of getting infected, to a greater or less degree, is part of the dynamic process of the outbreak. And I know because I can understand when I was at a stage in my life when I said, well, I'm invulnerable, so I'm going to take a risk. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, innocently or inadvertently, of propagating the dynamic process of a pandemic. Because the chances are that if you get infected, that you're going to infect someone else. And although you may feel well, and because we know if you look at the numbers that you'll probably hear later on, the overwhelming majority now of people getting infected are young people, likely the people that you see in the clips and in the paper who are out in crowds enjoying themselves, understandably. No blame there, understandably. But the thing that you really need to realize that when you do that, you are part of a process. So if you get infected, you will infect someone else who clearly will infect someone else. We know that happens because the reproduction element of the virus is not less than one. So people are infecting other people. And then ultimately you will infect someone who's vulnerable. Now that may be somebody's grandmother, grandfather, uncle who's on chemotherapy, aunt who's on radiation or chemotherapy, or a child who has leukemia.
The Department of Justice is actually arguing that the Affordable Care Act should be struck down before the Supreme Court. Yeah, filed it late yesterday. Now, again, here we are right now in the United States. 2,374,282 cases of COVID-19. 37,667 new cases. Y'all, 692 new deaths. Really? Really? Now we get rid of the Affordable Care Act. Dr. Georges Benjamin, Executive Director of the American Public Health Association. Doc, first of all, what the hell was Mike Pence talking about? Oh, how everything is reopening. The governor of Texas, my native state, literally said, shut all bars down, reduce capacity of restaurants, and said, y'all stay at home if you have to.
Yeah, he was spinning nonsense. You've got a very bad epidemic running through the South. And as you know, they're just pretending like it's not going on. It's the craziest thing I think I've ever seen.
Well, and again, what you have is Mike Pence and Donald Trump are in denial because they are scared to death of losing. And so they're hell-bent on reopen the country. But you see what happened in Texas. They did it prematurely. The governor ignored the mayors, ignored the county judges. And now all of a sudden, after opening it, now you got to shut it down because cases are spiking. Hospital beds are filling up.
You know, the challenge is, I think that there were many of the public health experts told them this would happen. You delay the preventive measures that we had, and then you rapidly open up too soon. This is what happens when you do that. And, you know, you open up the bars, and then now you got to close them back down again. They closed them abruptly today because, you know, people were congregating in those bars. And then they're surprised that lots of young people are getting infected.
Right.
And Roland, then as you said, on top of that, then they want to take the health insurance coverage away for the people that need it in America. And by the way, all of us will be impacted for it. A lot of people don't really understand that every person in America's impacted by the Affordable Care Acts if we lose it.
I mean, it's amazing how callous these people are, and really they refuse to listen to doctors, and they're hell bent on the stock market. It's just we don't care. Open stuff up, and what I keep saying, people are actually dying from this. And now, if you talk about half of the new cases are young folks, let their lungs all of a sudden start exploding, and then see what happens.
Well, the loss of the Affordable Care Act means that you can no longer carry your child onto age 26 on your policy. So young people will lose their insurance coverage as well. It's a terrible thing to do. And look, the really fascinating thing for me is the fact that the state of Texas is one of the lead litigants to try to get rid of the Affordable Care Act. And the governor of Texas is now saying, whoa, wait a minute. Maybe we need the Affordable Care Act, as well as many Republican members of Congress who were actively against the Affordable Care Act are now sending letters saying, well, maybe we ought to not get rid of it.
Yeah, that's what happens when you stuck on stupid. Simple as that. Dr. Georges Benjamin, Executive Director of the American Public Health Association. We appreciate it, man. Thanks a lot.
Roland, thank you very much.
Rob, these people have no damn sense whatsoever. I mean, they're really idiotic.
Yeah, they really are. And this, the resurgence of the coronavirus was not only predictable, it was predicted. Like, we follow data. I believe in science. They told you this was going to happen, but everybody wanted to reopen the states because they were following the prophets. They were following the idiocy of the present occupant of the White House, just because he said it was a sham. We got to go along with this stupid stuff. And then the only problem with that, I would be okay with stupid, but other people are dying because of their stupidity. And so us as people, we have to take our own government back right now because we have idiots leading us. We have assholes leading us, and it's causing real significant damage. And none of this is funny anymore. So, yes, so this is predictable. You have Texas talking about shutting down bars. They shouldn't have opened them in the first place. Now they're ironically causing more economic damage on the back end if they would have just done it right on the front end, followed the science, follow the facts, get politics out of it, and actually look out for people's lives. But that's just too much to ask, I guess.
Teresa, and not only that, you have the hearing, you had the news conference today, and you got everybody else wearing a mask. Pence like, damn, I'm not wearing a mask. That's how, and now you have the doctor saying, hey, could all y'all please wear your mask?
It's bad because when you have a highly skilled doctor and Dr. Fauci, where people believe him, it's like you're just disobeying the doctor's orders on purpose, right? And now you're passing it down to the citizens of the states. And so, I'm not surprised. I saw this 3-month confinement for most, and it literally was unbearable, right? So when the first protest happened and people were just unleashing their masks and raising their voices, I said, we are going backwards. The numbers and the data that we were able to achieve are now going in the tanks. And then what happened? Then we started to reopen, which began with the new phases, right? And so when the phases happened, that's when the dining happened. And when you're doing outside dining, the masses are off in its entirety, right? So it doesn't matter how close you are. Nobody was paying attention to rules. No social distancing was happening. The protests, the looting, all these are factors that, again, all happened if everybody was responsible. But again, it really comes to our leadership. So if our leadership is not doing what the doctor prescribed us to do in order to get out of this effectively, then we are at a lost hope.
And look, bottom line is, Derek, all the good that came actually out of the lockdown, they're about to squander it.
Agreed. But I would say that all of it don't go back to the administration, because there were standards put in place by the CDC that the states were to follow, and that control in terms of opening up the states was by the governor's call. Because right here in Maryland, we opened up until months after other places. And so now I think it's going to be left up to the states to handle at this point. Just like, as you said, your state, your home state, Texas, shut everything down. Yeah, but I think a lot of other states, unfortunately, going to shut things down too.
But Derek, I got to put the blame on the federal government, because like right now, the federal government is about to pull out of federal testing facilities in Texas. while the numbers are going up, that's stupid.
Roland, I can't speak on that. As we want testing, obviously the numbers are going to go up.
I think it's stupid.
But at the same time, if I can finish my point, it's the state. They gave control of the states. They had a guide. There were guides that they had to follow. 2 weeks without the numbers going up, and most of the states, that's what they hit. Those were the guidelines. Those were the measures that were put in place. Those were the metrics, and they hit that. So the states started reopening. And so now we're faced, because of, like I said, mostly young people out protesting, unfortunately, with what happened. That's why we're seeing these. These people hanging out in these bars.
Well,
the
that's actually not been true.
Mike
It's actually
hanging out in the
the data
bars.
has not
all
shown
right,
that the
Rob,
protests
20
have led
seconds,
to-
real quick, go.
Yeah, very quickly. The leadership sets the culture. At the very beginning, he said this was a hoax. He didn't take it seriously. He should have said a national response because it required a national response. Instead, he just gave away leadership and took no accountability. So this is what you get when you have no leader.
Look, bottom line is you just got trifling people.
All right, folks, back to that Roland Martin Unfiltered video in just one moment.
All right, fam, the folks at Seek.com, founded by Mary Spiel, a sister, of course. She is the inventor, the creator of these devices, this virtual reality headset right here. You saw it in the video there. And also the 360-degree 4D headphones. You can actually get these with a discount because they partner with us at Roland Martin Unfiltered. Right here, here's the code, RMVIP2020, RMVIP2020. First of all, folks, the headsets are phenomenal. The headphones are absolutely phenomenal. And of course, the VR headset is great because you just pop your phone, put it into the device, and then you can actually see video in virtual reality. So it's real cool. Go to Seek.com, Seek.com, CEEK.com, and use the promo code RMVIP2020.